Nick McConaughey looks after himself, taking boxing classes 3 times a week, as well as paying for a gym membership.
I really don't have any health issues. If I do get sick, it with a very mild cold.
At the age of 37, he sees exercise as a much better investment than private health insurance. So he's given it up.
I try and look after my fitness now because that obviously seems imperative. If you contrast that, say, with health insurance, it's something that might happen later in life. But right now, I see that money invested in my health around fitness and activity, physical activity is my priority.
51-year-old Anna DIMEAS represents the 44% of Australians with some sort of private hospital cover. She had 2 knee reconstructions last year and is due to have a hip replaced.
Because I had private health insurance, I was nil out of pocket. And if I didn't, I would have been $15,000 out of pocket for each knee. And the hip, I'm not really sure, but I think it's roughly, give or take, a few more thousand. Having private health cover is the best thing we've ever done, and I've never been without it.
With fewer young Australians paying for private health cover, some experts fear it could become unsustainable.
The private health insurance system in Australia is in a sorry state. In fact, you could say it's in a death spiral.
Health economist Stephen Duckett argues radical surgery is needed.
When young people drop out, the older people are left, they use health services more, so the costs are greater, premiums go up again, more young people drop out, and so there is this unsustainable death spiral that's really leading to serious issues for health insurance in this country.
Private hospital cover has been mostly declining since the introduction of Medicare in the 1980s. The Howard government tried to turn that around by introducing a Medicare levy surcharge in 1997, penalising those without private coverage. 2 years later, a 30% rebate on private health membership was introduced. In 2012, the Gillard government began means testing the rebate, but the decline resumed.
Basically, the industry's solution to every problem is to put their hand out for more money.
The only reason premiums go up is because health funds are paying for more health care.
With private health premiums outpacing inflation and wages, young people feel they have more pressing financial priorities.
Perhaps they bank that money now and in the hope that they might be able to scrape together a housing deposit.
In a survey last year, the financial comparison site CanStar found that just 58% of private health fund members aged 18 to 29 made a claim, compared to more than 90% of people aged over 70.
Young people use health services way less than the community average, and old people use health services way more than the community average. So there's this huge cross-subsidy, so it makes the product not value for money for young people and really value for money for older people, but that cross-subsidy is inherently unstable because everybody can rely on Medicare, so young people don't need health insurance. If they have something go wrong, it's usually an accident and they'll go to a public hospital.
Stephen Duckett's solution to stem the youth exodus is to do away with what's called the community rating system, which means everyone pays similar premiums despite their age or medical risk.
So what we're suggesting is that the subsidy that currently is spread across everybody be concentrated on older people. They're the people that use health services more. They're the people you want to make sure that can afford health insurance. And so you keep community rating for older people and you deregulate health insurance for younger people.
Then we'll have a period of time, maybe 5-6 years, where younger people in the health insurance pool will have significant reductions in their premiums. So they'll be happy for a while. The older members in that pool will have increases straight away. They will be unhappy.
George Savides ran Medibank Private for 14 years before retiring in 2016. He thinks getting rid of the community rating would see the public health system swamped.
The older members of the insurance pool leave. And where do they go? They go to the public system. Are older members high claimers of healthcare costs? 4 and 5 times the average claims cost of the population average claim. So the public system would get hit with a significant large queue of high demand patients and high cost patients, and that would put the public system under stress. So whilst it looks attractive to discount the pool for the young initially, it comes with a very, very bitter dividend.
But cheaper premiums, bigger rebates and more relevant coverage would help keep young customers like Nick McConaughey.
I would definitely consider keeping my private healthcare cover. So when I say the things that I might use, I'm talking about optical, dental, the extras that a young person are more likely to go into the system and use, as opposed to the very remote late life health events that are really hard to factor into your consideration as a young person.
That younger generation is feeling squeezed as they are needing to find the money in an environment of flat wages growth to support this. And we think there are some ways they can be better supported, but throwing out community rating is not one of them. We need to better articulate why it's value for money in that generation.
And do you think you're failing to do that at the moment?
I think we could do better.
In Perth, Sarah Anderson and her husband Les have also decided to do away with private health cover.
We decided to drop it probably about 12 months ago, I think now. We just were going through various different procedures. I needed a gastroscope for an ulcer that I'd had. Wasn't covered by private health, you know, and I then had to do it as public anyway. We just found that a lot of the stuff anything we were getting was more than covered by the public system. It just didn't seem to be the benefit, you know, for the few extras that we were actually utilising. No, I don't think you have to put your...
They're now saving the money they were spending on private health cover and using it to offset their mortgage.
We just go through every month the same amount that we were paying to the health fund. We just put in a bank account and just let that build separately. So whatever costs need to come out will come out of that. So for our glasses, it comes out of that. If we go to the chiro, if you want to sign up for the gym, we take it out of that as well. So it just worked better for our situation.
But the private health industry warns that saving for your own health needs doesn't always add up.
I'm always interested when I hear people talking about saving for their healthcare, because when you look at the data, you see that very few people actually really do manage to save enough money for a potentially a large or a significant health event. So the idea that people can save enough is often pretty much exaggerated or people tend not to fully understand the risk that they might be trying to offset.
Health insurance is in a sorry state. We've got to make it more attractive by reducing the cross subsidies to old people.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.